Before the COVID-19 pandemic, tuberculosis was one of the deadliest infectious diseases. It is estimated tuberculosis has caused more deaths throughout human history than any other infectious agent. Despite advancement in treatment and prevention, it remains a significant global health concern, particularly in regions with limited access to healthcare and resources. The National TB program says more children are at risk now, and parents must be vigilant to help in early detection of the infection. There's more in this report.
Prisoners, children, rural poor, persons living with HIV, minors and smokers are the key vulnerable population who easily contract tuberculosis due to factors like the quality of air in the environment where they find themselves. This is according to the findings of a research into tuberculosis by the National Tuberculosis Program. Senior lecturer and consultant at the School of Public Health, KNUST, Dr. Muhammad Aliyu, says tuberculosis is still a killer disease.
Generally, we know that TB is a public health problem and remains a significant disease in a country. So we need certain interventions. We need to strengthen or improve our intervention to meet the needs of the TB population. A normal person being infected and not having a strong immune system would end up getting the disease. So there's the need for us to raise awareness, not only in the key vulnerable population, but also the general population need to understand why there's a need for us to raise awareness.
According to Dr. Aliyu, the research was bedeviled by major challenges, thereby limiting the extent the study could explore.
There's the legal implications and also the financial component. The legal implication is that, look, you can't expose, it's ethically not right in research for you to expose the locations of individuals who, from the onset, the activities are deemed illegal. So you can't expose them. Secondly, we don't have enough funds to conduct this assessment. It's very important. NTP would better respond to TB. They can control TB better if we actually know exactly where these individuals who are at risk of vulnerable for getting TB. We need to understand their locations, but however, we don't really have enough funds.
Project lead Emanuela Bentum called on all stakeholders to join the fight against TB as it is claiming lives.
TB is very risky, and it was the #1 deadliest disease before COVID, but it's still hanging around. COVID has been dealt with, but what are we doing about TB? TB still hangs around us. That is why we make sure to map TB key and vulnerable populations in Ghana in order to reduce TB inequities. So we are not only bringing them on board, engaging and sensitizing key and vulnerable populations. We are also taking services to them, especially those who are not having access to TB services and care. So we are on the agenda, leaving no one behind, and we are carrying everyone along. In as much as we are sensitizing these key populations, we are making sure to engage lawmakers and policymakers that will make policy decisions and to suit TB key populations in order to meet their needs. So let's all call on our lawmakers and policymakers to do this for us in order to make sure our accountability is promoted.
The National TB Program has assured Ghanaians that it is working tirelessly to curb the rising cases of tuberculosis and urging affected persons to adhere to their prescriptions.